First, let's look at what you'll need. For subcutaneous injection, you'll need your B12 ampule, an insulin syringe, or a syringe with a 1/2-inch needle. 1-inch needles can be a little daunting when injecting into your stomach area, so we recommend you change to a 1/2-inch. You'll also need alcohol wipes to clean the ampule and the injection site, gauze to protect your hands when opening the ampule, a dressing to cover your injection site, and a sharps container to dispose of any needles and other sharp items. Let's begin. First, and most important, wash your hands with clean soapy water. Next, you need to prime the syringe. This is done by pulling back and forth on the plunger of the syringe to ensure that it moves freely in the barrel. Take the ampule and check to see which type of indicator is on it. In this case, the ampule has a dot, which should be facing away from you when you remove the top of the ampule. Take an alcohol wipe and clean the entire ampule, starting at the neck. Don't forget to flick the top with your finger to ensure that all of the liquid is in the bottom chamber. Wrap a piece of gauze around the top of the ampule and another piece around the bottom. Make sure there are a few layers of gauze. This is done to protect your fingers in the event that the ampule lid breaks. With your thumbs pointing inwards and as close to the neck as possible, push away from you with some force and the top should snap off cleanly. Carefully remove the needle cap from the syringe and insert the needle into the ampule and pull back on the plunger. Tilt the ampule to the side to ensure that you take up all of the liquid required for your dose, but be careful not to tip it too far. Pull back on the plunger to remove any liquid from the needle. Then tap the side of the syringe with your finger to remove any air bubbles in the syringe. In this demonstration, we are holding the gauze behind the syringe to show you the liquid coming out when we prepare the needle. You do not need to do this step and should always make sure nothing touches the needle. Push the plunger until a small amount of liquid comes out. Then carefully replace the needle cap at all times, making sure you do not touch the needle. If you touch the needle with anything other than the needle cap and the side of the ampule bottle, discard it and start again, as the needle will be contaminated. Locate the injection site for subcutaneous injection, which is shown in blue in the diagram. Be sure to stay at least an inch away from the belly button, as it is extremely painful. It is best done nearer to the side as shown in the demonstration. Clean the injection site with an alcohol wipe, starting at the point of injection in a circular motion, working outwards. Now you are ready to inject. It is important for subcutaneous injections that you inject at a 45-degree angle. Carefully remove the needle cap, then pinch or bunch up the skin. Using the same manner as you would to throw a dart, insert the needle into the subcutaneous area, making sure you hold the syringe at all times. Do not let go. Before you inject, you must aspirate the needle. Do this by pulling back on the plunger a little. Make sure there is no blood present in the needle chamber. If there is, you must remove the needle and start again with a new syringe and new B12. Slowly press down on the plunger. Do not inject too quickly or you may damage surrounding tissue. Remove the needle from the subcutaneous area by pulling it out at the same 45-degree angle that it went in. Then, with an alcohol wipe, massage the area to disperse the B12. Then place a dressing, such as a band-aid, over the injection site. Dispose of any sharp items such as needles or ampule bottles in the sharps bin.